Ketamine has the potential to change the way we manage patients with depression, specifically patients with major depressive disorder. Knowing how to use ketamine is probably as important as knowing how to use ECT. You cannot go through training in psychiatry as a DPM student, as an MD student, as a DNB student, without learning, for example, how to administer ECT, how to do cognitive behavioral therapy and other forms of psychological intervention. In the same way, it would probably someday become mandatory for students to be taught how to use ketamine in their clinical practice. Ketamine has now achieved that stature in many parts of the world. So, knowing how to use ketamine will soon become a need, just the way knowing how to administer ECT or how to do CBT has become a need. For use of ketamine in psychiatry, depression by far is the most important off-label indication. Ketamine can be used to treat patients with a major depressive episode with psychotherapy or by itself without psychotherapy. There is literature, not as strong as the literature on the use of ketamine for depression, but there is literature on the use of ketamine to treat alcohol and substance dependence, along with psychotherapy. And the psychotherapy is done either during the ketamine session or in between ketamine sessions. Papers have been published on the subject in journals as important as the American Journal of Psychiatry. Ketamine has also been used to treat generalized anxiety disorder, social anxiety disorder, obsessive compulsive disorder, post-traumatic stress disorder. But I would like to say here, the use of ketamine for these indications is questionable. You will see that I have put a question mark over there. The evidence for use of ketamine in psychiatry is solid for depression, weak, but there is evidence for its use in alcohol and substance dependence, and is very weak for these other indications: generalized anxiety disorder, social anxiety disorder, obsessive compulsive disorder, and post-traumatic stress disorder. I do not recommend that you use ketamine for any indication other than depression, unless more evidence is available for these other indications. Ketamine has also been used for abreaction, as for example in the pentothal interview, but this procedure is frowned upon, and I would not recommend that you use ketamine for abreaction either. So ketamine, if you are using it, should be used for depression. Does ketamine need to be given by an anesthetist, or do you need to have an anesthetist present if ketamine is being given in your clinic? And the answer is no. The reason is you are using ketamine in a sub-anesthetic dose. The dose is far lower than when ketamine is used in anesthesia. So if you are going to be using this in your clinical practice, people like your other colleagues in psychiatry, or people like your medical colleagues, or people like the administrators in the hospital where you may be practicing, they may ask you a lot of questions, and you should know enough about the research to defend yourself when you want to use ketamine in your clinical practice. Hello everybody, my name is Chitranjan Andrade. I am a psychiatrist. I used to be working as a senior professor in the Department of Clinical Psychopharmacology and Neurotoxicology at the National Institute of Mental Health and Neurosciences in Bangalore. I retired from service very recently, and presently I'm working as a guest faculty for Conceptual Psychiatry. I have a series of lectures for Conceptual Psychiatry, and you can access these lectures at the Conceptual Psychiatry website.